Dear Minister Hajdu, I'm a palliative care physician specialist. I have a number of patients who are suffering from existential distress due to their terminal illness. Sometimes this distress markedly increases their pain and most of the time negatively impacts on their family, their caregivers, and providers. I have had a couple of patients who have successfully received an exemption and have had positive effects of the psilocybin in the context of a program of psychotherapy. My other patients are continuing to wait for exemptions. I have had Health Canada request detailed medical information regarding my patients' care for those who have submitted a request for exemption. They have requested a list of medications or other conventional treatments that my patients have received. They have requested medical information on prognosis and treatments. They have requested details of the nature of their distress. The information request exceeds that I am required to provide on a MAID assessment for a patient. Minister Hajdu, I am a MAID assessor. When I perform a MAID assessment on a patient, the province, the health authority, and my regulatory bodies rely on my abilities as a physician to determine to either support or reject a patient's application for MAID. I nor the patient are required to give detailed accounts of their suffering or methods to alleviate their suffering or their treatments. Only that they are suffering, that they have a terminal illness, and that their death is in the foreseeable future. I, as a palliative specialist and a general practitioner in oncology, have determined that my patients would have significant benefit from access to psilocybin treatment. I find it curious that Health Canada is challenging a physician for prescribing a safe and effective plant-based medicine to alleviate pain and distress. I find it distressing that patients are dying before they receive their Section 56 exemption or receiving their exemptions days prior to death. Why are we treating patients who have had months of pain and distress only days to weeks prior to their dying? Would they not benefit from treatment at the time they start experiencing the suffering? I understand that those patients who are actively dying have been given emergency exemptions. Treating pain, which has been there for months prior to death, just before somebody dies, is inhumane, particularly if they have been requesting alleviation of their suffering for months. I would ask Minister Hajdu that you find the compassion to grant my patients with terminal illness their Section 56 exemptions now, while they are suffering, not just before their last days. I would ask that Health Canada respects the professional and experienced opinions of patients' physicians when they recommend their patients for this treatment, and that they are not challenged with the recommendations. I am the care provider who witnesses the distress and suffering of my patients. I witness the distress and suffering of their caregivers and their family members.